we're just gonna start off with pelvic floor anatomy. So in general, you have 3 diaphragms to your body, okay? Diaphragm is just like a dome-shaped structure. So the first is your throat, the second is your respiratory diaphragm, and the third is your pelvic floor diaphragm. These 3 diaphragms work together to manage pressure and stabilize your body. And so if we just think about like the respiratory diaphragm and the pelvic floor diaphragm, they are essentially the top and the bottom of your inner core. So if you ever heard like brace your core, you're actually working with this structure and this structure, and then it's the ab muscles that wrap around. Together they create a canister, think of like a soda pop can or something, and they all work together to manage our pressure, okay? So the throat part is like when we inhale through our nose, right? Our diaphragm is going to lengthen, drop, and our pelvic floor lengthens with it. So they both go down when we inhale, and then when we exhale, the diaphragm will lift and our pelvic floor will contract and go up. So this system is always working together, sort of like moving down and up together. That's why in pelvic floor therapy, we harp so much on the breath part, because it's sort of like driving our pelvic floor in a sense, okay? And then it's just the ab muscles around. So that's our system. I'm gonna be referring to notes. My baby's going through a 4-month sleep regression right now, and I'm working on very little sleep right now. So we'll be referring a little bit, but yeah, so that helps to manage our pressure. If we look at just the bottom of that canister system, our pelvic floor, right? Our pelvic floor sits at the bottom of our pelvis like this. It sort of is like hammock shaped, and it consists of 14 different muscles. So these 14 different muscles, I tell people they're just like any other muscle in your body. They need to be able to contract and relax, okay? So they need strength as much as they need length. I tell people, like, think of a trampoline. They sort of have to have that range of motion to function. Especially if you think of like end stages of your pregnancy, 3rd trimester, that's when we really start working on the lengthening piece, because these deep muscles back and through here, they actually have to lengthen 250%. They really have to go, you know, like this to let baby out if you have that vaginal birth. So, you know, you oftentimes in like Instagram hear a lot of like Kegels, like pelvic floor strength during pregnancy. That is helpful for sure. But if I'm working with someone, I'm working on that like 1st and 2nd trimester, and then that 3rd trimester, I'm really working on that lengthening piece. And so that is our pelvic floor, and our pelvic floor muscles, they're in charge of bowel and bladder function, so poop and peeing. They're in charge of sexual function. They are help hold our reproductive organs up, and they help with pressure management. So if you think of pregnancy, they're working really hard to hold all of those organs and a growing baby up, okay? So it's really common sometimes in pregnancy to start getting tension in them, because they're like, oh, we got this, you know? But sometimes they don't got this, and it can get hard, and that's where we might have symptoms of like pelvic pressure or just heaviness down there. So if we just circle back to this system and we look at the first diaphragm we talked about, our respiratory, or our throat, our epiglottis. And so if we're looking at this is just where we let air in and out. That's like the importance of this one. But I do want to touch on just the jaw piece. So our jaw and our muscles in through here, and like our tongue, they share fascial connections, a deep connection to our pelvic floor. So the only reason I want to touch on that is if you tend to hold tension in your jaw, say you are a teeth grinder, you tend to suction your palate to the, you know, your tongue to the palate a lot, like the roof of your mouth, or if you tend to grind your teeth, that can directly create more tension in your pelvic floor. So so anatomy kind of information on that is when you're in your embryo, the first two holes to form are your mouth and your anus. And so as you continue to grow and develop, they will share a connection into adulthood, right? That creates a deep front fascial line. It's a thick piece of fascia, essentially, a connective tissue. So if you tend to do any of those things with your mouth, I just like to promote like a relaxed mouth. You'll think about that during your labor process, but also good to think about that now. So we're just gonna do a brief activity. I'm gonna teach you what natural resting mouth position should feel like and what it's like. So essentially you'll want your mouth closed, your teeth are slightly apart, like not touching essentially. Your tongue is resting, and the tip of your tongue is actually touching the back of the two front teeth, or like the very tip top of your palate. So it's just kind of like lightly suctioning there. So you shouldn't be feeling too much tension, okay? Alternatively, hello. Come on in. You found us.
I found you.
I know, sorry, I did not make a sign, and I was like, I hope people, if they come to Premier, maybe know, but maybe not.
Yeah.
Well, welcome. What's your name?
Thank you. My name is Ashley.
Hey, Ashley. How far along are you?
I'm due in September, so I just hit 28 weeks, 30.
Cool.
Yeah.
So we're just talking about anatomy. So that's normal resting mouth position. So real quick, I'll have everyone stand up to do this. So we just talked about your jaw is connected to your pelvic floor, and they share fascial connections. And so if you tend to grind your teeth or clench, it can create a lot of tension in your pelvic floor. So natural resting position is teeth slightly apart, relaxed tongue just sitting at the back of the two front teeth, you know, kind of relaxing through here. Now what I want you to do is suction your tongue. Oh, so now you have that position. I want you to just tune into your abs and your pelvic floor. Like, what do you feel, right? Shouldn't feel much. Okay, now I want you to suction your tongue to the roof of your mouth, super strong. Okay, did you feel any change in your abs or your pelvic floor at all?
Abs for sure.
Abs for sure, okay. Yeah, no, maybe? Okay, that's okay. So some people feel it, some people don't, but if you felt it, that's that fascial line, so we can kind of get instant feedback onto that, okay? You can sit back down. Okay, so we just talked about this diaphragm, so now we're gonna go to the respiratory diaphragm, your breathing, okay? And so you've probably heard of 360 breathing. Is that a yes or no? Okay, yes. So, no? Okay. Yes and no, yes and no. So, when we think about the pelvic floor, you know, we talked about the diaphragm connects to our pelvic floor. They have a synergistic relationship. So breathing is really important, and how we're doing it plays a big role on how we're like working our pelvic floor. So when I look at someone's breath mechanics, if I'm assessing you, I want what I call 360 breathing. And all that means is if you think of your lungs like a balloon, you want them to expand from all sides, right? 360. That's how your diaphragm works. And your diaphragm actually sits at the bottom of your rib cage. So when you inhale through your nose, what I want to see is movement coming from your chest, movement coming from belly, and movement coming from rib cage, especially like side and front and back. So I want to see expansion coming from here, and then I want to see expansion coming from front and back as well. I think that's the biggest missing piece I see a lot with people in their breathing mechanics if they're practicing like pelvic floor lengtheners or diaphragmatic breathing. They're just not breathing well through here. So the two main faults I usually see with like breathing assessments is one, you know, I'll be like, okay, take your breath, and they'll go like this. So this is what I call a chest breather. They're using their neck a lot to breathe, can create neck tension. All of that air is going down, up. None of it is going like down, where that's where we sort of want it if we're working on pelvic floor lengthening. and your rib cage is actually like narrowing up, which is the opposite of what we want. The other fault is belly breathers. So all like my yogis, belly breathing can be great, but if you think about that air, where you're sending that air, all of it's going forward. And so if you're someone who's already dealing with diastasis recti when you're pregnant, or you're healing from diastasis recti, that belly breathing it can actually like create a little bit more strain in that front part of the abdomen. So postpartum, you know, I really emphasize working on like breathing through here so that you're dispersing that air and not just like creating front pressure, okay? The just like cool reasons why you should be working on like deeper breathing. Your lungs are more oxygenated at the bottom, so they're more vascularized at the bottom, sorry. So that will send more oxygen to your body, which is really helpful as you're making a baby. So that's a benefit. And then 2 is getting that diaphragm to like move more. It will stimulate your vagus nerve, which is in charge of kind of that rest and digest. So it's really helpful to like decrease stress and improve like more calming effect into your system. So that's like that 360 breath component there. So in general, the better breath mechanics we have, the better pelvic floor function we will have. We'll have better posture, pressure management, and stability, essentially. So I'm gonna have everyone stand up. Oh yeah, go ahead.
I just wanted to ask, do you have like a recommendation for how much we should be practicing that like daily, the 360 breathing?
Yeah, I actually tell people you can do it daily, almost as much as you want. Like what I do throughout the day is like if I'm working at my desk, it literally is as simple as like taking a deep breath, but making sure you're breathing through here. At the end of the workshop, we will go through positions that I like to practice it, because I do like to, you know, bias, like, you know, you getting on your side and like working like this and really opening up those spaces. So there's definitely positions that help like facilitate it more, but you can do it any day, right? We breathe so much throughout our day that just taking the time to perform a proper 360 breath is just really beneficial to your system. Just don't like only do that and then hyperventilate basically afterwards. But every day is great. So we're gonna stand, we're gonna try it. This is your workout for today. We're gonna be doing a lot of standing and sitting. Okay, so you're gonna place your hands at the bottom of your rib cage, okay? So you're gonna take an inhale through your nose, and then you're gonna exhale out through your mouth. When you inhale, I want you to think about breathing into your hands, pushing them apart, and in the back, you should feel your thumbs expand back as well. So it'll look like this. And then just exhale out like you're fogging up a mirror. Ideally, your exhale is twice as long as your inhale. That'll just help promote more of that parasympathetic, that like relaxation piece. So from the side, it'll look like this. You see my thumbs expand, exhale out. As you exhale, that diaphragm, the ribs will narrow, okay? So it's rib cage out to lengthen, then rib cage in. That's just kind of like as you exhale. How does that feel? Yeah? So when you do that, now I want you to, yeah, so I think we'll just stop there with that. Usually I get people in positions, but maybe we'll just save that for the end. So you can take a seat again. So that, yeah.
Are there any benefits in like keeping the rib cage expanded as you breathe out?
Yeah, that's
instead of I'm a singer, so like I went to school for singing, and like we did a lot of like classical singing, and so there's a lot of that like I've spent many years expanding all of those, or like spending time like focusing on all of that.
Yeah.
But like with classical singing, your like focus is like keeping it expanded and keeping it kind of buoyant as much as possible as the like abdominal and the other muscles sort of like contract, so not allowing it just to fully like collapse in on itself.
Okay.
and like doing this sort of thing, but trying to keep it, the rib cage open and expanded as you like breathe into it and then like let, so I'm just wondering if there's any benefits to like that
Yes.
style.
So I do work on pause to holds, but actually, so I don't know too much about like why you do that with singing, but postpartum, it's really common that people end up in a very, we call it like in a state of inhalation where they end up like this, wider rib cage, because your baby essentially pushed your rib cage up and out and your organs got pushed up and out, you know, and their diaphragm actually stays up and taut. And so we need to actually work on something I call like ha breathing, but a lot of the like relaxing down, because that's your diaphragm in a state of exhalation, it brings you back down. So if you've like seen, people are like, oh yeah, my rib cage is like wider postpartum, and like, or my ribs are like really flared out, we call it rib flare. It's because your diaphragm is actually stuck up. So that's where that exhale piece, and I'll say like, can you hold 3 to 5 seconds, where reteaching that diaphragm to come down is important. I usually don't promote inhalation as much. It really though depends on what you're presenting. If someone's stuck here, then I will, you know? So it's all just what the diaphragm is doing. So the reason why we harp so much on breathing is because if we're not managing our pressures well with like this whole system, mismanaged pressure can look like leaking, incontinence. It can look like pelvic organ prolapse. It can look like hemorrhoids. It can look like a diastasis recti that is having a hard time healing. It can look like back tension, neck tension, right? So there's a lot of symptoms that you can get because of honestly just how you're managing this pressure system, okay? And so now we've talked about the throat. You missed the throat part a little bit. We talked about the throat. We talked about this part, right? So now we're gonna talk about our abs. We're sort of making our way down our ab piece to the pelvic floor, okay? So our abs, and when I say abs, I am mainly talking about your transverse abdominis, which is sort of that corset muscle. It's like this big muscle that wraps around your spine and hugs it. It's really great for spine stability. It's what we really want to work on during pregnancy and postpartum, because what's happening to that muscle is it's just getting like really stretched out right now because of growing belly. So that ab piece, it works synergistically with your pelvic floor. And so what that means is just when you turn on your pelvic floor, that muscle will also kick on a little bit. So they sort of like go hand in hand. And so when I think about activating this muscle, I like to give the cue of like, think about like your belly button going up and in, or if you think of like a zipper from your pubic bone, think about like zippering up, because sometimes you'll hear the cues of just bring your belly button to your spine, if you've heard of that. What that's doing is it's actually like cinching you at your rib cage, and it's ignoring this bottom piece that's really important. It's part of that core, right? So it's kind of like putting pressure down. So if you think of like just belly button to spine, if you look at here, that's like pushing out, right? Because you're cinching here, that's gonna create a little bit more pressure in your pelvic floor. So you really wanna work on that like zippering up and in cue, okay? And how you coordinate that is, we talked about inhale, everything's lengthening, expanding, right? Pelvic floor lengthens, abs lengthen. When we exhale, that is when we will contract, do the zipper up and in, ribs come down. It's all this like, it's kind of like an orchestra. It all works out and then back in, okay? So that's the ab piece. Just wanted to touch on how to activate it. If you're doing a lot of like core work during pregnancy, you really want to think about like zippering up and in versus just like pushing in, okay? And so we said those muscles work with our pelvic floor. So lastly, we're gonna touch on the pelvic floor. So we went over anatomy a little bit. But like we said, the pelvic floor is the bottom of your inner core structure. And so when you inhale, these muscles will expand and lengthen. When we exhale, they contract and lift. So we are going to touch on Kegels a little bit, just because I feel like that's like the biggest thing. People are like, how to do a Kegel, right? But I just want to give a little disclaimer. We said that these muscles need to contract and strengthen sometimes, but sometimes they need to lengthen and relax. So if you're just doing Kegels, but you already have tension in here, that can just make things worse, in the sense of like you're just tightening a tight muscle, and really what you need is lengthening and like relaxation. You don't fully know where you're at unless you get an internal assessment. Sometimes you can kind of gauge it with symptoms, but really an internal assessment is the best way to find out what those muscles are doing. So I will touch on Kegels, but in no way am I telling people to do Kegels, because we don't know if you have tension or if you actually might benefit from Kegels. We don't know. So when I think of doing a Kegel, there's two parts to your pelvic floor, like two sections if you're looking at it from this angle. One is your urogenital triangle. It's the top part of your pelvic floor muscles, and then the anal rectal triangle, which is like the back side of your pelvic floor muscles. When I tell somebody to Kegel, I think about bringing your clitoris, like the top part, and then your anus, the back part, together towards the center. So a lot of times when I assess someone's Kegel, they're doing a lot of like back tensioning, or they're just like missing out on some of the muscles up here. But remember, it's all of this, okay? So think of like top and bottom coming together, and then your pelvic floor is, there's depth to it, right? It's a 3D bowl, and there's like, these muscles are in layers, so there's depth. And so when you contract, I also tell people, like, think of having, like, there's like a marble inside of your vaginal canal. You're trying to pull that marble up to target the deeper muscles in through here. And so we usually pair this contraction with your exhale. Remember, exhale is when we contract everything. So we're gonna practice all of that. I know that was a lot, but we'll go through it. So I'll have everyone stand up. Great. So we're gonna just start with first our 360 breath, okay? So hands on the bottom of your rib cage. All right, you're gonna first inhale. This is the lengthening piece. Ribs go out and then expand in the back. So, right, and then just exhale. Don't think too much about it, okay? When you inhale, try to limit shoulders from going up, okay? So they can move a little bit, but you don't wanna feel or look like this, okay? So that's our breath part. Now we're gonna tie in the contraction piece, the activation piece. That'll be with your exhale. So when you exhale, you're gonna let the air out, your ribs will come down, you'll zipper your core, and we'll just do the core first, okay? So you're gonna inhale, that's the lengthening piece. As you exhale, think about pulling belly button up and in, okay? So that's working ribs and core. Now we're gonna tie in the Kegel piece. So you're going to inhale. As you exhale, feel the rib come down, belly button up and in, and think about doing a little bit of a Kegel lift, okay? That's front and back with a little bit of a lift. So let's try that 2 more times. So big inhale. As you inhale, you should feel pelvic floor maybe relax a little bit. And then as you exhale, there's a lift and a slight lift in your pelvic floor as well. Try 1 more time. Inhale, everything relaxes, belly lets go, pelvic floor lengthens. Exhale out, everything kind of tightens up. That's how you perform a core brace, okay? Yeah.
So when you're lifting the Kegel, are you holding the Kegel for it, or is it kind of just lifting in and then dropping down?
Depends what you're going for.
Okay.
Yep. If somebody needs endurance, like for my endurance athletes or just in general, sometimes we'll work on like a 5-second hold. It just depends though where you're at. Sometimes I have people contract and hold, and they can actually, like their pelvic floor will hold, and like in 2 seconds it starts to let go. So endurance is a piece of what we assess in pelvic floor therapy, especially if you're like, I want to go back to running, but your pelvic floor only can hold 2 seconds. You know, that's that endurance piece we have to work on. So you can work on it for sure. It just also matters where you're at. Any questions on that? How did that feel?
How many sets? Like, do you, like, 2 things, like, how many sets do you usually recommend doing, like, over a period? Is it sort of like, okay, you're like weight training, so you're gonna do like 30, or you're gonna do like 10, or whatever, like 3 sets of 10 or something? And then the second question is, how does that affect, like, in the pregnancy along as well? Like, how far along do you do that throughout the pregnancy?
Mm-hmm.
You know, is there a time when you're like, oh, don't do it, or you should try to do that throughout your whole pregnancy and into postpartum, or, you know, like,
Yeah.
what?
So honestly, without proper assessment, I don't recommend doing Kegels, just because there is that possibility that you have a tensioned, tight pelvic floor. And so, like, going back to my disclaimer, I'm not recommending that you do them. And I will say, if I do prescribe them, it's very individual. Like, if I'm dealing with someone who's leaking, like incontinence, I'm probably gonna do higher volume versus someone who's not and just needs like the brain body connection. So it totally depends.
Are there certain symptoms that, like, lead you to believe whether someone has a tight pelvic floor or more of a loose pelvic floor, I guess?
Yes, but a lot of times they can present, they like cross, like if someone has leaking, it can be because of weakness, but it can also be because of tension. So it's really difficult to say without that assessment. And so, yeah, I'm not gonna like try to guess, right? Because I wouldn't feel like ethically that's right, you know? But yeah, so, and then part B was, I did touch on this, like usually what I like to work on during the 1st and 2nd trimester is a bit more strengthening. There's good research that shows like strengthening your pelvic floor helps with urinary incontinence postpartum. So that's where I like work more on like core pelvic floor strength in general. That 3rd trimester is really when I start gearing towards more of that lengthening piece, because during labor, those pelvic floor muscles really need to lengthen, get out of the way sort of thing. And so that's when I'll work a lot more on that lengthening pelvic openers and not so much of the strength piece. Postpartum, I was gonna touch on this, but it's good to start activating these muscles. I say as early as 2 weeks. I think the 6-week like check is just, you know, there's reasons for that, but I think it's an awareness of these muscles, getting them to turn on, especially your core, is really helpful postpartum, as long as you didn't have any complications or are dealing with pain, right? So if you know, there's still sort of that like, you know, individualized thought behind starting these things. But if I'm working with you, I can usually gauge, and I start people like at 2 weeks, start breathing better, start, you know, activating that core, right? Because you're gonna need those muscles literally the second you come home, right? So there's no point in waiting 6 weeks to start turning them on when you're getting up 10 times a night because you have to feed your baby every 2 hours, right? And you'll be surprised at how much you need to move your body as a new mom. So, yes. Did that sort of answer your question?
Yeah.
Yeah.
I mean, yeah. Generally.
Yeah. Okay, so that's the whole system. We kind of worked through that. So we're just gonna quickly zoom out, and we're gonna look at posture. So like we're looking at like how this whole system's like integrated essentially. The reason, you can sit down. I will have you stand up in just a little bit though. The reason why posture is so important, well, it's not so important. I mean, the reason we look at posture during pregnancy is because very common pregnancy postpartum posture is that we end up in sort of this position, right? So our belly continues to grow, and just because of gravity, we literally get pulled forward. But that position, what happens is if you just think about the diaphragm and the pelvic floor, how we want them to connect, what happens is our diaphragm gets shifted up as we tend to lean forward, and our pelvic floor gets pushed down when we end up in this position, that anterior tilt. So then they can't communicate as well, and that's gonna decrease our stability, okay? Not only that, as we do this, it can lead to tightness in your butt. So if you're dealing with things like hemorrhoids, or just like any back tension, that can create more like butt gripping is what we call it, or tension back there. And it just doesn't set us up for good stability throughout our system. So, and then postpartum, we see a lot of that because we sort of get stuck here, where our ribs are sort of like flared out, our core is really lengthened out, and we're having a hard time like bringing everything back. So I'm gonna have everyone stand up. I told you I would. And this is helpful, it's keeping you guys a little bit awake. I don't know about you, but during pregnancy, for me, I had the most fatigue I have ever experienced in my life. And my husband now will be like, well, are you more tired now, like with our baby? And I'm like, no, there will never be a fatigue the way I felt during pregnancy. But I know everyone's different, but damn, it was hard. Just, we're gonna stand, right? Just think about how you're standing, okay? And what I want you to think about is just, like if I'm teaching someone to like have a little bit of better posture, right? A really common, like simple cue is if you feel like you're here, think about bringing your pelvis back, okay? So you're just getting your pelvis underneath you. That's gonna help stack your rib cage and pelvis better. You might even feel like a little bit of a better core activation once you get your pelvis back. The other cue I'll give is think about having like more weight in through your midfoot or your heel. So if you feel like all of your weight is on your toes, think about bringing that weight back, okay? So that's gonna help stack you up a little bit better. The last one is like, think about when you're back here, try to relax your sternum a little bit. So we don't like this high arched position that will create tension in our back, and it's bringing our ribs up, which we said we don't love that. So think of just like relaxing in through here a little bit. And so that's gonna help kind of like stack you a little bit better, okay? Did anybody notice a difference when, as we went through that like scanning with their posture, or did everyone feel like they already had that?
I was pretty arched at first, so then I kind of tucked in with the heel, and that helped.
Yeah, decompress the low back. Cool.
Other ones, for the particular ones that can help with like heartburn, acid reflux.
Man,
In terms of like posture.
I also had that. I mean, obviously like making sure that you're reclined up, but unfortunately, no, that's just that laxity in that.
I saw this one video where this lady's like, you can like, totally put your hands under, like just slightly under your ribs and like help to pull it out. And I'm like, are you kidding me? Like I can't get anything into my, it's so tight.
I know.
Are you kidding? It's like,
she probably was not pregnant at the time.
no,
of
but she
doing
was
that.
an older woman. She was, it was soft looking, she was able to get in there, and I was like,
Honestly, I had that during pregnancy, and it's just make sure you're drinking magnesium, I guess, but no, I don't have anything for you on that one, sorry. Okay, so that's the posture check, and just a little acronym I say to like avoid clenching in the wrong places is JAB. So jaws, abs, and butt. So if you feel like you're clenching your jaw, if you think that you're clenching your abs all the time, which we don't want clenching here, and then if you feel like you're like clenching your butt a lot, check yourself with JAB and make sure like you're not clenching those things and you're just kind of bringing yourself back to center. a lot of times you can catch yourself if you're the type of person who leans on the counter a lot when you're cutting veggies or washing your hands, and you're constantly on the counter like this and you're just riding there. That's because you are asking your body for more stability, but you're also relying on the counter and not giving it yourself. So bring your hips back and wash your hands and try to not always get into like this position. You'll end up doing it more than you think, especially like once you have baby. Ergonomic wise, we love holding our babies like this because we can lean them on our chest. That's like, realistically, you will probably end up doing that, but I just remind my mamas, like, try to get out of that position a little bit, like rock your baby like this a little, bend your knees, right? Don't always just be arching into your back, clenching your butt. You know, it's just not a very stable position. Okay, so we talked about breathing, right? I feel like we've hit that pretty well. We talked about core bracing, a lot of different positions for core bracing, but sort of the mechanics there. I always pair core bracing with breath though, if you're working through it. We talked about pelvic floor lengthening. Those muscles will lengthen 250% at that during labor, so lengthening is a really good thing to start working on, especially that third trimester. So with birth, we want to also work on pelvic mobility, like pelvic openers, to make sure that our pelvis, essentially what happens as baby is starting to descend down, first we need a lot of mobility in the top part of our pelvis to accept baby. And kind of at that 36-week mark where our baby's head really starts to get in contact with our pelvic floor muscles and it's getting ready to come out, that's when we need pelvic, what we call pelvic outlet, but it's the bottom of your pelvis, to open up more. So first it's like, accept baby up here, and then it's like, all right, let's get out of the way and open up back here, okay? So there's specific movements you wanna work on to help facilitate that, okay? So we're gonna go through just a few of my favorites, and then we'll sort of do a little bit of habit training and wrap up from there. Could everyone grab if everyone feels comfortable like doing these movements, does everyone feel comfortable getting on the floor and like doing a couple hip openers? If everyone can just grab a mat so that you can just have support for your knees, really.
These too.
Yeah.
Oh, my whole closet full of pregnancy items.
All right, cool. Okay, so, and just sort of find a good place on the floor, wherever you can feel like you can do movements, okay? So the first movement we're going to go through is a pelvic inlet opener, that top part of your pelvis, like we said. So what I like to do, this is called fencer position. You'll get in this like half kneeling position, okay? And then what you'll do is sort of, if you are arched, try to think of like getting your pelvis underneath you a little bit, but not clenching your butt, right? Just a little bit of a positional change there. And all you're doing is rocking forward, getting that knee to fall over the foot. You might have seen this in a lot of pregnancy videos, but the reason for it is we are working on opening that top part of that pelvis. So just give space for baby. And you know, rock honestly as much as like you feel comfortable. I do this like 8 to 10 times. When I was really pregnant, I definitely used a ball for stability. We just don't have a lot of balls here, but I'm just holding on to something as I'm rocking forward and sort of thinking about maybe driving your knee up and out so that we're working on stretching that front piece. And so I usually always want to balance myself, and I'll do the other side.
So it's sort of at an angle too. It's like
Yeah.
going to the left.
Yes,
Or,
yes.
Like to the triangle versus like going forward.
Yes, exactly. Like think about those pelvic bones like wanting to come out. How does this feel for everyone?
Good.
Anybody noting tension in the inner thigh at all?
Yeah.
I'm feeling tension in
You're
my
end
back.
stage.
I don't know if I'm in the wrong spot or
Huh?
something. I said I'm feeling tension in my back. I don't know if I'm doing it incorrectly.
Are you thinking of tucking in a little bit here? Or think of zippering core up and in, and then going maybe not as far? Does that change anything?
Not really. I felt like I was already trying to hold in,
Okay,
but yeah.
I don't have to assess you.
Yeah.
Cause I do movements like this and some other ones at home. I don't know if this is what's supposed to happen, but I feel like right after I do the movements, I'm even more sore. And then like maybe like the next morning, I'll feel really good. Like I feel like I don't feel the effects of it until the next day, but
Yeah.
like right after, like so I usually try to save it until I'm like done moving around for the day.
Yeah.
Because like I feel like more sore after I do my exercises. I don't know if that's what's supposed to happen.
I would say it depends how you're doing them. And yeah, like how your body's responding it. I don't know if you're like overdoing it in a sense and that's why your body's getting sore, or honestly you're just holding a lot of tension throughout the day and then it feels like a little sore in like a good way. So it just kind of depends. I would say like if you're not actually increasing pain or it's not lasting like, you know, into the next day or anything, I'd say that that's a safe zone, but making sure we're staying away from any like pain signals versus like soreness.
Yeah, like it's not like painful, it is like soreness.
Okay.
And like I do feel better the next day, but it's like right after I do all of those exercises, I'm like, okay, I need to go sit down and like not move.
Yeah.
Because now I have a lot of pressure that I didn't necessarily have right before I started sometimes.
Then I would be curious about your breathing, and then I would be curious what movements you're doing, you know? And it's hard to say, just like, cause I don't know, but yeah, I would just make sure they generally should feel a little bit better after exercises.
Okay.
How many sets do you recommend doing? How often?
These? So on it, like I said, it really is patient dependent. There's not really much overdoing these unless you're doing like 100 of them. So sometimes I tell people 8 and that feels good. Sometimes people like to go to 15 because they're really liking the movement, and that's fine too. But you know, not just like hours of this, right? The second exercise, so this is pelvic inlet. Really common is for your inner thighs to get tight during pregnancy because they have your adductor muscles that connect to your pubic bone, and sometimes they're just working really hard to stabilize you. So I like to get up on all fours. If you feel comfortable doing this, stick your leg out and then rocking back. So you'll get your butt to your heel. And I like to mix breath in with this. So I'll inhale as I sit back, exhale as I come up. Feel free to bring that foot up if that feels more comfortable, or plant it down. With this one, just making sure that you're getting your butt to sit straight back. So if you feel like you're really like tilting to one side, like sometimes your butt just like goes off to the side, making sure that you're like getting butt to heel, sitting straight back to get the length through there. How does that feel for everyone?
Tight.
A little tight.
These are hip openers?
Uh-huh.
Oh, okay.
Well, adductor stretching, but yes.
It's like stretching right here, is that?
Yes.
Is it supposed to feel like it?
And then you can switch.
Now, how do you do it with the belly? Like making sure that, because if it's directly over, my belly's like already like pushing in on the thigh, so I can't get to my.
Yeah.
Is it better to move more?
Yeah, you totally can. You could also just modify the range. A lot of it's like modification, what your body feels is right. You could also sort of like probably use the ball and do like this, but that requires a lot of hip strength up here. So now we're going to look at pelvic outlet opening. So that back side of the pelvis we talked about. So for that one, it could be sort of tricky, but this one is just, I call it butt breathing. But you essentially will want to get on your forearms, butt up. And then the most important thing here is that your knees are further out than your feet, okay? Because that's what will help sort of splay the sit bones. So you're sort of in this position, and all I do is practice literally breathing into my butt. That's gonna be helping.
The feet are further out from
Yes.
the knees.
Yes, yes. And so with every inhale, think about sending air down in through this space. So this position is just helping stretch these bones out, and then we're working on breath to get length in through here.
Am I in the correct position, or because I feel like I'm not feeling anything?
Yeah, you totally are. It's all about just sending breath. Maybe try tilting your pelvis a little bit, and now think about breathing really deep in through here and like into your backside as much as you can. Just being in this position is helpful, okay? So like getting your knees in and feet out as much as you can. That's already helping opening up that back space, if that makes sense. So it's just a stretch in itself, but the breath piece helps to sort of lengthen the pelvic floor muscles.
How much
Is it
should
better
we,
to have your knees closer or farther apart?
Knees closer, but it also depends, like you said, on belly and your comfort. But if you can get at least like your feet further out than your knees, then that's sort of where we want to end up.
how much should we be like tucking our pelvis or like sticking it out?
For me, sometimes it depends on comfort, but also how you feel more length. So if you inhale and you're a little tucked here and you feel like that gives you more like awareness of like breathing into the back, that's better. If you want to relax, that's fine, as long as it feels more relaxing to you.
Okay.
Is that?
I feel like if I'm like kind of arched down, I feel like it comes out of my stomach more. Like
Okay.
If I breathe.
That's great body awareness. So go ahead and I do prefer tuck in.
Okay.
It's just sometimes when our belly is growing, it can get a little harder, and then it's actually more restrictive. That's really why.
Do you ever put cat-cow breathing and that kind of thing with it?
So that's all fine. These are just like specific to the pelvis, inlet and outlet. Okay, so those are like my big pelvic openers. I just want to everyone can take a seat. I just want to spend the last few minutes here talking about like habits and pelvic health. So during pregnancy, these are sort of the things that like I like to like educate on just briefly as a pelvic floor therapist, or some things like I wish I knew more about when I was pregnant myself. One is doing a lot of just in case pees. So if you've noticed that you have more urgency or you need to pee a lot more frequently, that's pretty common during pregnancy. Makes sense, there's a baby sitting on top of our bladder, right? But looking at just in case pees, those are pees that you do just in case, right? So if you are gonna leave your house and you really don't have to pee, but you're like, I'm gonna pee just in case, and you pee like a little trickle. So what that's doing is it's gonna continue to create urgency because you're essentially teaching your bladder to empty when it's not really full. So that can create like a lot of urgency postpartum or the more you do it. And it's also making your bladder just not expand as much. So just, it's not helpful for like bladder health, okay? So I get that you probably need to pee a lot more than you used to, especially as baby continues to grow, but trying to sort of not just give in and pee like 30 times a day is helpful for your overall system down here. Drinking water, staying hydrated obviously, but what helps with that urgency if you are having it is drinking sips throughout the day, not giant gulps, because that giant gulp will get sent to your bladder and then you get this big urgency symptom. So small gulps throughout the day can be helpful. A big one is making sure you're avoiding or trying to manage constipation if you're having it, okay? During pregnancy, but especially postpartum, I just didn't know how constipated one could really get postpartum, and it can be pretty significant. And I wish like when I had my OB, like we talked about that a little bit more. So I got a stool softener right away, just because, I mean, think of if you have a vaginal birth, like you're healing down there, you don't want to be straining those muscles. Not only that, we already have pelvic pressure that happens postpartum, right, from delivering the baby. Constipation will just make that pressure worse. So if you're dealing with things like hemorrhoids or prolapse, it's just something we really want to try to avoid. So I personally had a stool softener on hand because I was like really constipated postpartum, and that just kind of did not help with some of my symptoms. So just flagging that if you want to talk to your OB about that. But what happens is our hormones really can create a lot of constipation.
What do you think about like natural methods like prunes, that kind of thing? Like, cause I found that I'm just increasing the amount of prunes that I eat a day, like a handful with whatever meal I'm having.
I think that's great. Yeah, fiber is like your best friend during pregnancy and postpartum. I think natural is totally great too. I just personally got so constipated, I literally needed a hefty stool softener. But natural is great too. Just making sure that you're thinking about that and staying on top of it if you start to notice those symptoms of constipation. Using your core to brace during movements of pregnancy and postpartum. So I get a lot of patients with symphysis pubic dysfunction, like pain here at that pubic bone area. And a lot of it is because you're not stabilizing well. So we just spent a big portion of this workshop working on like learning to stabilize and use your core. So when you're rolling over in bed, you have this big belly. I know it's getting tough to roll over in bed, or postpartum when you are getting up or rolling over to feed your baby or whatever. Just think about that gentle lift. It really can make a difference with some of the pain symptoms that might come up, okay? Last thing is I just want to touch on like libido. So everyone's libido can change during pregnancy, postpartum. Hormones are fluctuating a lot. But I will say that like pain with sexual activity can be pretty common postpartum, okay? So just because you go to your 6-week checkup and they're like, yep, you're good to have sex, whatever, a lot of times women are just not ready at that time, and sometimes you are, sometimes you're not. But pain can be common for a lot of different reasons, right? You could have had a tearing, you could have had new tight pelvic floor, you could have hemorrhoids, right? You don't know. But I just want to say it is common, but it's not normal. So making sure we're addressing that postpartum is important. I brought in actually like lube samples just because I'm big on like sexual health, and so sometimes making sure like if you are getting back into sex, using a lot of lube can really help, things like that. The last thing is perineal stretching. So going into like the lengthening piece at the end of your 3rd trimester. If you've heard of perineal stretching, you're just, I usually recommend this at 33, 34 weeks. The perineum is the tissue that is in between your vaginal opening and your anus. It's right here. It really has to stretch during labor, okay? It gets up and out of the way. If you've heard of vaginal like tears, that's usually where people will tear. Not always, but it can be a place where people tear. And so I'm a big proponent of doing perineum stretching at around like the end stage of that 3rd trimester. I linked a YouTube video on, I'm gonna give out these handouts. It has the YouTube video on there where I have a video that walks you through it, how to do it. But that's just a piece too, and like going back to like the sexual part, if you are having pain with sex, sometimes it is because people are tight in this area as well. And so just something to consider, think about. I also do that with lube if you're doing it. And that's sort of it. I want to spend time answering any questions. In general, I hope this workshop was helpful and educational. I know we went through a lot, but I hope you got just even a little bit out of it. And like I said, my clinic where I work is 8 minutes from here. I love working with pregnant postpartum moms. Sometimes I see pregnant moms for just 1 or 2 visits, and what we do during that time is we make sure that your ligaments around your uterus are mobile, your pelvis is mobile, and how your pelvic floor is, especially if it's like getting ready for birth. Sometimes we do biofeedback where, you know, we're doing an internal assessment and we're checking like different positions, how your body responds and how your pelvic floor feels during those different